want to show you the setup of the stuff first. So if you were to grab one of these kits, try to grab a practice one that has 2 containers and a large one. Some of them have like a combined, like only 2. Make sure it has 2. In the bottom, you want the ties. Then we're going to use the fenestrated or split gauze. 2, maybe 3 regular gauze. Then on top of that will be the cotton tip applicators, pipe cleaners, brush, the like dentist drape, the suction catheter, and then 1 set of sterile gloves, and then just close it. So you have your kit, a towel, water, clean gloves. I like to just reuse. These are the sterile gloves that come in here, but how in the world are you supposed to put these on sterile? Because they're usually like this in the kit. And an extra pair of sterile gloves, because we're going to use 2 sets of sterile gloves. Let's just open up and look. Struggle's real today. So we're going to look previously at the medical record for hydration status. So remember I said hydration status in the room because we want to know how thick are the secretions. We also want to know our patient's ability to cough. Not that that's going to matter, but if our patient has been hooked up to a ventilator or something, we want to know. We're going to listen. We want to check vital signs, especially oxygen. If they don't have a continuous pulse ox on, you should put one on. So we want to make sure our patient's oxygen isn't dropping. We're going to listen. We usually listen to the lungs first. We want to know what they sound like. And then level of consciousness. Not really going to matter, but if our patients, like I said, are the level of consciousness are getting more sleepy, we may not want them on room air. So we're not a good time to do what we're going to do. So our supplies, like I said, all on the table. Same stuff we always do. Knock, introduce ourselves, 2 patient identifiers, name, date of birth, allergies. We're doing trach care. We're going to put on clean gloves. We're going to put on our clean gloves. We are going to come over to our mannequin. There should be a dressing underneath here. Didn't notice it. There should be a cut dressing underneath here. I know, they're really loud. So when you come over to her, it should look like this. This is a trach collar that provides oxygen to our patient. It's just hooked up to the wall, oxygen, and there should be a dressing underneath here. We're just gonna move this to the side. We'll just say, if you guys move it to the side and just leave it there, that's okay. We'll just say that your patient's oxygen's fine the whole time. Okay. We're gonna take out the soiled dressing. So we're just gonna pull this off. We're gonna look around the site. We're gonna look to see, is there any redness, irritation? We really wanna look at the ties too. The ties on that patient are kind of like a lanyard, like they're moving back and forth and like digging sometimes into the skin. We just want to see if there's any sores. Maybe it's too tight. You can just take it, put it at the end of the bed. We're going to take off our gloves. Now we're going to come over here. We want to perform hand hygiene. We're going to turn on the suction. We want to make sure that the suction is working because that's what we're used to suction with. So we want to make sure it's working. I can take the towel and place it over the patient's chest. I'm going to take my kit and make sure that it's a sterile kit, that, you know, obviously we do those things that are sterile. I'm going to open it away from me. If you need to open a little bit more, you can. You can pick out the other pair of gloves so you can expose the catheter. Water is going to have to go in because we need to lubricate the tube. If you get one that is sealed, just pull back on it. And we want an acceptable height. We're not doing a waterfall. We're not jumping over. And I don't want you like touching the kit. Like an inch or two, like this is fine. So just dump a little. We don't need a lot of water. It's not real. A little bit of water. Tap back on. I'm gonna put on my first pair of sterile gloves. Here's stair gloves. Now we can touch inside the kit. I'm just gonna take the catheter out. In my dominant hand, I'm just gonna wrap it around so it doesn't accidentally touch anything when I'm going over here. We don't want one of these deals, you know, where it's, we wanna make sure it stays sterile. Wrap it around. I'm gonna take my dirty hand and I'm gonna pick up the suction tubing with this end, because it's wrapped around. I just like to pinch it with my thumb and my pointer, push them together. Then we would undo this. This tube is way too short and slab. I'm too far away, but dirty hand, I can touch the outside of the kit. So I would take this and dunk it in here and hold the hole. The hole is what's gonna suction. So you're gonna hear this just blowing in real life. When you put your finger on over the hole is when it sucks it up into the canister. So I would just put it and I'm gonna prime it by getting just a little bit of water in there. I'm gonna take my thumb off. I'm gonna come over to my patient. I'm gonna let them know I'm gonna suction, and you're just gonna stick it on the inside without having your hand touch the inner cannula. So we're just gonna put it in there. Just keep feeding it until we hit resistance where the patient starts coughing. So you can actually feel it. Can you hear it? It's resistance. When we're coming up, we could twirl it and move it out. At the same time, we're gonna have our thumb go over this and suck intermittently. We are going to be down in the trach less than 30 seconds. We like to be down less, but 30 seconds maximum. Not 3 minutes, not 10 minutes. Our patient would start deoxygenating. Now that we've done this, we can just take this apart. You can use both hands because now you've touched it, it's dirty. We're going to take off our first set of sterile gloves. If you want to, because it does tell you you could keep replacing the oxygen. I'm not really particular, like I said. We can just pretend that our patient can. Second set of sterile gloves. Could you use this as a field if you want? It's labeled on the kit as a waterproof drape. So waterproof drape usually means we're going to put it on the patient. So same thing like the Foley, shiny side down. Now I'm going to get my stuff ready in my kit. So I'm going to take, which remember you're sterile, so you can use both hands. Take your brush and put it on one side. Take your cotton tip applicators, dip them, put them back in the big one. I just don't want the water to fall out. Take 2 gauze, dip them in one side, bring them out. Put them in the big, so it should look like that. We're gonna pretend like all of these were 400% closer than what I did. Okay, now I need to make sure clean. I'm gonna use my right hand, dirty, I'm gonna use my left. So I'm gonna come over this tray, be careful. It's like not in here. And I tried to put tape on here to make it stick, but it's not. So you just pinch the side and pull it down the curvature of the neck. And we are going to stick it on the same side of the brush. We're going to do the dishes. So we're gonna soak it with my dirty hand. I'm gonna pick it back up. I'm gonna take the brush, not over the kit. I'm gonna clean it. So you're using a sponge or a scrubber. Holding onto here, not holding onto this piece that goes inside, we're holding on the outside piece. Now this, when you're done cleaning, don't stick the brush back in the kit. We're gonna drop it to the side because it's dirty. Now we're gonna go into the second thing of water. We're going to rinse it. We're gonna pick it back up, take our pipe cleaners, we're gonna dry it off. My dirty hand is going to stick it back inside the trach. Now what I'm going to do is I'm going to clean around the outside. So I'm going to take my first cotton tip applicator in my clean hand. I'm going to put it in my dirty hand. I'm going to clean around the hole. So underneath, once swipe, dirty. There's a lot of this going on now. Dirty. clean the plastic, skin, dry one, pat around. Clean one is gonna pick up the fenestrated one. You're gonna need both hands now. So we're gonna open it as wide as we can, and stick it underneath, and then stick it underneath each of the ties. There's too much tape, I gotta fix this. Ties. Old ones stay tied. Slip it through one side. About that much. Take the other one without twisting it. Put it around the other side. Tie the ties to the trach, or else your patient won't be able to move their head. We're going to tie the two ties together on one side. Now we're going to untie the old ones. Take them off. Measurement of the take it off. Take off your gloves sterilely. Perform hand hygiene, make sure your patient is in a comfortable position, and then make sure that they're not laying down.